back an hour, or maybe your internal clock is still adjusting. But for some, the end of daylight saving time can be more than just feeling jet lagged or a little blue. Seasonal affective disorder is a type of depression that happens during certain times of the year. This is because not as much sunlight results in a chemical change in the brain, leading to symptoms of sadness and depression. So who is at risk and what can you do to fight it? Clinical psychologist Dr. Raé Nicole Lundy joins us now with some answers. She's the director of counseling services at Georgia State University. Raé Nicole, thanks so much for being here. We appreciate it.
Happy to be here.
Yeah, so, okay, so you work on a college campus. Do you see a lot of seasonal affective disorder, or SAD as it's commonly referred to as?
Absolutely. College students tend to retreat. At times it's difficult for them to go to class during this time, so definitely for college students. But I'd like to say that seasonal affective disorder is common among all Americans. So for those who've experienced a history of depression, for those who live in parts of the country where the sun doesn't shine as much or where it's much cooler, college students, but really, Chris, everyone experiences that.
I'm glad you mentioned that because I grew up in the Seattle area, and growing up, I mean, we just remembered, you know, in the fall, it gets very dark, a lot, you know, combination with the rain. We always said, like, oh, we're so depressed. You know, that was, you know, years ago. But then we realized, oh my gosh, like, there's something to it.
Yeah, there really is something to it, because what you find is you're having less energy, you're feeling more fatigued. Literally, your body isn't producing the same chemicals it does when the sun is shining more. And so what we are asking folks to do who are experiencing SAD is to pay attention to what you're eating, how you're sleeping, how much you're moving, and even just opening those blinds. Those are things that can be really helpful for anyone who might be experiencing the mood changes that come along with SAD.
And doctor, what are some of the symptoms that people should be on the lookout for, you know, if they're, you know, sitting at home thinking, oh, like, is this actually, you know, something clinical, or is it just the mood, you know?
Yeah, so changes in sleep, increased desire for carbohydrate-rich foods, finding yourself a little bit more irritable, and also having difficulty with focus, concentration, and just overall a sense of sadness, as the acronym says. The challenge is we all experience this, but if it persists for more than 2 weeks, and if you find that you're not able to get out of your home or do the normal things that you do, then that's what you want to be aware of, and when you may want to seek a little more support.
And with that said, I just know, should someone be calling their primary care physician or getting in touch with a psychologist? What do you recommend?
A primary care physician can identify these symptoms, but I'm probably a little biased. I would say as a clinical psychologist, we would be the person who you might feel most comfortable talking to about something like this, because we can provide, in addition to what the physician might share, we can provide other forms of therapy like light therapy, cognitive behavioral therapeutic techniques. Those are some of the frequently used strategies to assist with SAD.
Sometimes, though, I think people like wonder, you know, it's that barrier to entry, right? They're like, oh, like, who do I go to first? Like, do I need to get a referral? And you talk about insurance and all of that stuff, right? And so, but it's so important to make sure that, you know, you connect with somebody, right?
Absolutely.
So that you can hopefully develop that relationship and have that conversation.
I think that's a great thought, Chris. Whoever you feel safest with, whoever is a licensed professional who may be able to differentiate. I know a lot of times we feel really comfortable talking to our friends and family, but they may not in that instance be the best person to differentiate between just your normal sadness and something more serious. So you're right. If you feel most comfortable talking to your PCP, if you have a therapist, or if you even often someone's spiritual supportive person, finding ourselves someone who's trained to understand what those symptoms look like and who can provide you with some really simple but effective ways of relief.
Yeah, keep that conversation going. Don't be afraid to ask for help.
Absolutely. In our culture, sometimes asking for help is seen as a negative thing, but what I really encourage my college students, as well as anyone who I'm seeing in my private practice, it's okay to not be okay, because if we ask for help, it won't stay that way.
All right, Dr. Raé Nicole Lundy, thank you so much. Appreciate it. Clinical psychologist and director of counseling services at Georgia State University. Thanks for coming in today. Stay close. We're back after a quick commercial break.